Can CBC detect esophagus cancer? CBC complete blood count is a common blood test that provides information about the cells in your blood, including red blood cells, white blood cells, and platelets. While CBC can sometimes indicate certain abnormalities in the blood that may be associated with cancer, it is not a direct test for esophageal cancer. Esophageal cancer is often diagnosed through a combination of methods, including endoscopy. This involves the insertion of a thin, flexible tube with a camera endoscope into the esophagus to examine the lining for any abnormalities. Biopsies can also be taken during endoscopy for further analysis. Imaging tests. These may include computed tomography CT scans, positron emission tomography PET scans, and sometimes magnetic resonance imaging MRI scans. These imaging tests help determine the extent of the cancer and whether it has spread to other parts of the body. Biopsy. During endoscopy or other procedures, a small tissue sample biopsy is taken from any suspicious areas in the esophagus. The tissue is then examined under a microscope by a pathologist to confirm the presence of cancer cells. Barium swallow. This is a special type of X-ray test where the patient swallows a liquid containing barium, which coats the inside of the esophagus and makes it visible on X-ray images. This can help identify any abnormalities or blockages in the esophagus. Blood tests. While CBC is not specific to esophageal cancer, other blood tests may be used to assess liver function, kidney function, and levels of certain tumor markers that can sometimes be elevated in people with cancer. It's important to note that the specific diagnostic tests used may vary, depending on individual factors such as symptoms, overall health, and the suspected stage of the cancer. Early detection and diagnosis are key in improving outcomes for people with esophageal cancer.